Syed Hussain from Trinity Health of New England joining us. Always great to have you here.
Thank you for having me.
Health Watch. A lot of people watching, they might see some headlines and they have a lot of questions, so they want a little bit more, and that's where you come in. It's really great to have you here.
Thank you.
First off, let's talk about the life expectancy age gap. It has grown significantly. Now it's about 6 years that men live less than women. So talk a little bit more about that.
Yeah, this is the largest age gap we've seen, Erica, in the last couple of decades. It's gone up now, so it's a little under 6, as you said, for men compared to women. A large reason driver is the pandemic, because the pandemic impacted men more than women. But there are other reasons too, including mental health conditions. There's homicides, suicides, opioid abuse, related deaths. So all of them taken together have decreased life expectancy for men more so. The gap has widened compared to women.
And the other issue that people might be seeing a lot online is the increase of syphilis among newborn babies. Talk a little bit more about that. The percentage, I think it's up somewhere around 32%.
Yeah, this is very sad, and it's very, very
scary.
concerning. Absolutely.
Yes.
This is in the backdrop of just a big rise in sexually transmitted diseases we've seen across this country over the last few years. But the rate of syphilis in newborns, congenital syphilis, has actually gone up 10 times, Erica, over the last 10 years. And just between last year and this year, it's been we've seen a 30% increase. So basically, the take-home message here is if you're a woman of childbearing age and your partner, you need to get tested. If you live in a county with high syphilis rates, right now the CDC defines that. They have a map. So please look up cdc.gov for additional information. But 70% of U.S. counties are seeing a high rate of syphilis. So those individuals will qualify to get screening tested.
Now I have a question, because normally when you are pregnant, you go and you do a number of tests. You have, I don't know, give 12 vials of blood, and they run tests for everything. Isn't that one of the things that usually they would test for?
It should be. And if it's not, you need to ask your doctor to make sure that it is, because this is a treatable condition. It's benzathine penicillin, which in turn has had issues over the last couple of years in terms of supply chain and all of that. But having said that, it's important that we do the first step, which is to get tested.
So if the mother is treated while she's still pregnant, does that less the chance of passing that on to the newborn?
Yes, it's treatable, absolutely.
Yeah.
It will. So, but they need to get tested and treated at the same time.
Yeah. All right, definitely. All right, let's also talk about lung cancer and the increase in survival rate. That is some really good news, actually, right?
It is, because there have been so many advances over the last few years in terms of targeted therapy, immunotherapy for lung cancer. Bottom line here, though, is, Erica, more people who qualify to get screening done, and we touched on this last week when it comes to Movember and men's health and getting age-appropriate cancer screening, it applies to both men and women. So if you are someone who's had a heavy smoking history or current smoker, and if you fall between the ages of 50 and 80, you may qualify to get that low-dose CT scan as a screening tool. Because remember, lung cancer, if detected early, can lead to more than 60% 5-year survival, as opposed to late stage, which is less than 7% survival.
Now, I have a question. A lot of people with insurance, they might think to ask their doctor about that on their regular checkup. What do people who don't have insurance? Are there, do you know if there's resources available?
Yeah, there should be tools. Go to your Department of Public Health, speak to your provider. There are clinics that are available, especially in urban medical centers that may offer some sort of program where you can qualify to get these screening modalities done.
Right, but definitely get tested if you are a previous smoker.
Absolutely.
Dr. Hussain, thanks so much for
being with us.
Thanks so much.
Thank you.
Great to have you here.